My name is Jonathan Coyle. I'm a paramedic and a field supervisor with Cypress Creek EMS. And Cypress Creek EMS is the 911 ambulance provider that covers this area of county. First off, I wanted to say I really like how you all came in dressed and looking professional today. That's really a plus when it comes to the business world. So when you go in for your job interviews, if you all were dressed like this, that's the first step in grabbing my attention, is that you all take it seriously. So I want to thank you all for doing that. Today we're going to talk about emergency medical services. I assume that because you're all in here, you all have somewhat of an interest, maybe in the back of your mind, about doing this. Am I wrong? Is that right? Yeah? Okay. So today we're going to go over basically where EMS came about, what it is, what exactly we do, and then I was asked to go over a little basic about how my day goes when I'm working in EMS. If you all have any questions throughout the presentation, feel free to ask me. Once I leave here, Nancy Wilson, one of your all teachers in the back, also volunteers with us. I'm sure she'll be more than willing to answer any questions that you all might have, all right? Okay, so where did EMS come about? EMS is actually, the modern day EMS, getting in an ambulance, going to a 911 call, is actually pretty new. But does anyone have any idea where it first started at? Anyone want to guess? Back in the Napoleonic Wars. Napoleon was one of the first people to actually send people out onto the battlefield, pick up his wounded, and then bring them back to camp where they would treat them. So that's where the whole idea of picking up the sick and injured and bring them to another location to take care of them. As EMS evolved, we come to the modern day where the community is requesting the same services that people are getting on the battlefield. Hey, I can't get to the hospital, I can't get to the doctor, I need you to come and take me. So initially, it was doctors and nurses who would get into a horse and buggy or get into an early car, go out to the house, make a house call, and then need be taken back to the hospital. Only until recently, has anyone ever seen the show Emergency? I know it's probably way before your time. You have Johnny Gage and Roy DeSoto. They're the first paramedics in LA County, and they're actually working for the fire department. They go out to 911 calls, and they take care of the sick and injured, and then they bring them back to the hospital. So we do a lot more than just 911 calls. You do have your 911 response, so whenever someone picks up the phone, they dial 911, they say, I need an ambulance. The dispatcher then sends the ambulance out to wherever they are. That's what we primarily do at Cypress Creek EMS, and many of the other agencies around here, that's what they do. But you also have other things that ambulance crews do as well besides the 911. They also do what's called interfacility transfers. And interfacility transfers are if patient is at one hospital, but that hospital isn't able to treat them very well. So an ambulance crew will go to that hospital, pick up the patient, and then take them to another hospital. They also do transfers such as grandma is at home, but she needs to get to her doctor's appointment. She can't walk very well. Or John Doe is in a nursing facility and needs to go to dialysis, but he can't walk. So we have interfacility transfers that will take the patient to wherever they need to go and then bring them back when they're done. We also have air medical services. This is more experienced EMTs and paramedics. They work on helicopters and fixed-wing aircraft, and these are higher level transfers. So basically, in this area we have Life Flight and we have what's called PHI. These are two scene medical helicopter services. And what they do is if we have a very, very sick patient or a very, very injured patient, they will come, they will land wherever we are, and then they can take the patient onto the hospital. And the idea is that they can get to a hospital a lot faster than we can, especially in Houston. You know how the traffic is, right? Especially during rush hour. Sometimes patients don't have that long, and they need to be seen by a physician right away. On occasion, you'll also see ambulance crews or EMTs working in a hospital or clinic setting. We see a lot of this around here. They work as emergency room technicians. they work at doing vital signs, basic bandaging. They assist the doctors and the nurses on a more superficial level, but they still provide an integral part of the healthcare system. And then anyone interested in possibly going to the military? Anyone? No? Not at all? Okay. In the military, you have a field medic or a corpsman. Corpsman's from the Navy. And these are EMTs and paramedics in the Navy. They just want to go by a different name. But they provide treatment and care to soldiers out on the battlefield and in their mobile field hospitals. So we're talking today about EMTs. And when I talk about EMTs generally for you all, I'm referring to Emergency Medical Technician Basic. So this is the basic level of knowledge. You learn how to do CPR, you learn how to do basic first aid bandaging, you learn a couple medications that you can assist patients with. First responders. This is for emergency services in very rural areas. First responders they are just below EMT basic. They don't have a whole lot of knowledge with regards to pathophysiology, how the body works. They're trained in very minor first aid, and they're trained in CPR. Their job is to basically handle the patient until an EMT basic or higher can get there. So anyone who's interested in doing EMT basic, this is where you would start out off, and I'll go over courses and education here in a few minutes. Once you're done with Emergency Medical Technician Basic, and you think, hey, I want to learn a little bit more. I want to do some more things for my patients. I want to be able to help them out better. You can progress to the Advanced EMT. Sometimes you may hear it referred to as the EMT Intermediate. And in this part of the city, EMTs are very, very close to paramedics. They can start IVs. They can intubate patients. That's putting the tube down their throat to help them breathe. They can administer almost every single medication we can give except narcotics. And they have a lot more advanced knowledge about pathophysiology and how the body works. Paramedic is the what's the word I want to use? Is the top level for EMT for field medicine. So they're in charge. They have as much knowledge as they can get for pathophysiology and anatomy and physiology. They understand how to use the cardiac monitor. They know how to interpret electrocardiograms. When they give medications, not only do they know how to give the medications, they understand why the medication is working the way it does. So that brings us to education. So you have so many different avenues for learning how to become an EMT basic, and I've written a couple of these down on the sheet that I handed out to you all. Primarily, you will see EMT basic courses taught by private organizations or universities. Around here, top educators for EMS, we've got Lone Star College, does a lot there. Your all's school actually has a program, I believe it's called Practicum in Health Sciences, and that's another avenue. And when I say private organizations, my company, Cypress Creek EMS, also teaches. There's another organization called TX that teaches as well. And when you go into your education, you decide, yes, I want to do this. So you're going to have several different methods of instruction. First, you're going to be sitting just like this in a classroom, listening to me lecture, and I know you're bored to death. It was supposed to be a joke, come on. So you're listening to a lecture, you're learning just like you would in a normal classroom setting. Once you learn from the instructor during the lecture, then you do what's called skills practice. So basically you get out the mannequin, you get out the little dummy, and you practice your skills. So you're practicing your CPR, you're practicing how to do splinting and bandaging. When you get into your higher levels of care like intermediate and paramedic, you're practicing intubations on your mannequin. There's one point during my paramedic clinic, or during my paramedic education, once we were taught how to do IVs, we would do IVs on each other in class. So you actually practice on live people for sometimes. Once you're done with your in-classroom instruction, you move on to in-hospital. So you're actually seeing live patients, you're taking vital signs, you're practicing your bedside manner, because that is one of the important parts of medicine, is learning how to interact with your patients. And then you also have what's called ambulance clinicals. So once you're done with the hospital, you actually go out into the field, onto the ambulance, you ride shifts with them, you become a crew member just like everybody else. You learn how to operate on your own without a physician, or how to operate under your protocols, how to run an ambulance, so keeping it stocked, keeping it clean, knowing how to get to your patients, because sometimes we're not giving correct directions or we're not giving correct addresses, so we need to learn how to navigate. So, what does it take to become an EMT? So, number one, this is set by the state, is in order to get your EMT license, you have to be 18 years old. You can start your education when you're 17 or 16, but you won't be able to actually test for your license until you're actually 18. You can't have any felonies on your record at all. And when I say minor misdemeanors, this is nothing violent, nothing towards, or that's showing aggression towards another person. So check fraud might be okay. I'm not telling you I'm committing check fraud, but you have to have a state license. So once you finish your education, you do what's called your boards. So basically, you have one day where you go in and you show your instructors that you know how to do all of your skills. And then once you're done with that, you have a written test. So simple questions like that. You have to have a driver's license with a good driving record. A lot of companies have requirements on on how many tickets you can have or how many moving violations you can have on your record. BLS or elective courses, basic life support you'll learn with your course when you take your EMT basic. But this is your basic CPR. This is learning how to do compressions, how to do ventilations. And then once you progress through your medical education, you can take other elective courses. ACLS is Advanced Cardiac Life Support. This is learning how to treat a patient who's in complete cardiac arrest, using medications, using the cardiac monitor. BTLS is Basic Trauma Life Support, so injured patients. PALS is Pediatrics, so teaching or learning how to take care of children, because they're very different than taking care of adults. And then one thing people frequently forget about, even when they're in the middle of learning EMT basic, is their continuing education. EMT, just like any other medical practice, is the practice of medicine, and it continually changes. So we are required to go to school for the rest of our life, basically. You're required to learn or to attend so many hours of training every time you renew your license. So for me at the paramedic level, every 3 years I have to do 72 hours of schoolwork, basically. So I go and I learn various disciplines, I learn the latest medical technologies and techniques to stay up to date with my education. All right, so they want me to go over my basic day working in EMS. It all starts out with getting to work on time. Normal, I laugh about this, but this is a big thing, because the shifts that we work usually are 24-hour shifts, sometimes they're 12-hour shifts, and a lot of times we can't, or the person who was working before us can't go home until we get there. So, because someone has to run the ambulance, and if someone calls 911 at the moment of shift change, it still has to respond. So, for us, our shifts start at 7 a.m. They go from 7 a.m. to 7 a.m. We do have some shifts that are 9 a.m. to 9 p.m., 10 a.m. to 10 p.m., and we have one shift that's Monday through Friday, 10 to 6. I would love to have that shift, I really would. All right, once we get to work, we have to check out our equipment. So we go through the entire ambulance, we look at every single piece of equipment, we make sure that we have it in the right quantities, that it's not damaged, that it's working correctly. We have everything that we need to run for the rest of the day. Practice. We talked about continuing education just a few minutes ago. Many times we come to work and we attend lectures or continuing education classes. We'll practice on our mannequins, we practice our intubations. Clean. I was talking about cleaning earlier. We don't have someone to wash our trucks for us or to restock them. That's all on us. So we have to make sure that the truck is clean, that it's restocked, that it's ready to go. And then a lot of times it comes down to just waiting. So when we're on duty, anytime that we're not actually on a call, for us we have a station, so we go to the station, we have a kitchen, we've got a living room, we can watch TV, we've got bedrooms for sleeping at night, and we wait for a call to come in. That's kind of what our towns sound like. And then it's time to get to work. So anytime, day or night, anytime someone calls 911, we respond to it. So car crashes, trip and falls, fell off your bike, we get them all. Like I said, we work 24-hour shifts. So unfortunately, there are a few companies out there that do this, but the majority of them, we don't have scheduled breaks. So a lot of times, many other organizations or many other companies, not in EMS, you want to take a 10-minute break, you want to take 30 minutes for lunch, that's fine. Unfortunately, we don't have that luxury because our ambulance has to be available to respond 24 hours a day. Our break time is when we're not on a call. So, we've been working all day, it's 3 a.m., we are all tired. We try to lay down. Nope, it's time to go back to work. But I kid you not, I put these up here because despite how hard we work and how much or how long we work, we make a difference. A lot of times the patients that we see don't have the time to waste to wait to see a doctor. We are on the front lines of medicine. We are there to make a difference and we save lives. Without us, thousands and thousands of people could die. There's actually one patient I talk about on occasion. I wish I had put his picture up here. I didn't think about it for the last minute. But it was a cardiac arrest patient that I was actually able to save. He showed up at one of our company parties about a year after his incident, completely fine. He was a stand-up comedian, so he was able to go stand up and do a presentation or a stand-up bit for us. And it's so rewarding to be able to see your patients fully functioning without any problems and enjoying life because you stepped in and made a difference. So, presentation wasn't that long, so a lot of this is going to be question and answering. Does anyone have a question right off that's burning in the back of your mind? I know you all have one. Come on. No. Yes?
Can you show us your equipment?
I can. Yes, I can. So, like I said, today, actually in 45 minutes, I go on duty. I'm a field supervisor. So this is some of the equipment that I brought from my supervisor vehicle. This is our cardiac monitor. So I was talking about learning electrocardiograms. We also use this as kind of an AED. Who knows what an AED is? Yeah, good. So we can, if a patient needs to be shocked, we can shock this way. We can measure how much oxygen is in your blood, how much CO2 you're breathing out. There's so much information we can learn just by a few little devices on patient. This right here is my drug box. Now, my supervisor bag does not have nearly all the drugs that are normally carried on the ambulance. We carry about 25 different medications on the ambulance, and I carry 1, 2, like 6. Mine is designed just for to survive until the ambulance gets there. Because if I'm going to be on a call, the ambulance is coming, I just may have to beat them there just by a few minutes. So I've got medications in here for diabetic. I've got cardiac medications in here. If someone has an allergic reaction, I've got Benadryl. If they have an overdose, like they took too much of a medication, I've got an antidote for that. This right up here is my bandaging in my trauma section. I've got gauzes, I've got vomit bags, because those are really handy. I tell you, I kid you not. Now, vomit bags will save your
You feel like you're
tuchus.
getting really fast too.
Yep. No, they are quickly. Roller gauzes. This one, I always like this. I've yet to use it though. This is what's called an ARS needle. So if you have a trauma patient and their lung collapses, I kid you not, the needle is that long, and what it does is it goes into the chest and lets all the air out of the chest so that the lung can reinflate.
Any volunteers for that one?
I've got a small oxygen tank. What else do I got in here? Thermometers. This is my IV kit, so I can start IV medications. I wish I had a full ALS bag to show you all. That would be much more interesting. Anything else? Come on. Come on. All right. So let's go over the handout I gave you real quick, because I had to do a little bit of research. I wanted you all to have all the information you would need if you chose to do EMS now, or if you wanted to do it down the road. So at the top, I listed the general requirements. You know, you got to be 18. So here at the school, practicum in health sciences. If you want to do be an EMT, that's the course you want to go through. I was talking to one of your health sciences instructors earlier, and she said that the cost is about $1,000. And the thing is that because you're going through Lone Star, so you're paying for the tuition for the instructors, you also have to pay for uniforms and equipment. So your stethoscope, your blood pressure cuff, your pen light, your trauma shears. Those aren't included in the course. You'll need those, especially when you go out into your field rotations. But she did say that it is cheaper going through the high school than it is waiting to graduate and then choosing to go through Lone Star later. If you have questions, talk to your counselor or your advisor, and they'll be able to tell you a whole lot more than I can. Lone Star itself has 2 avenues for doing EMS education. The first one is for credit, the second one is not for credit. So for credit, this is actually getting college credit. So if you want to do other courses or you want to get a degree later, this goes towards that. Lone Star does have financial aid. So if you don't think you can afford the money now, you can apply for financial aid and you can get a lot, if not all, of your tuition covered to go to EMT school. And then Cypress Creek EMS also has an EMS education program. Our next course doesn't start until February. It's cheaper than going through Lone Star, but right now we don't do college credit, so it's a not for credit course. Is anyone here a volunteer firefighter? No? Okay, well if you were a volunteer firefighter as well, you get a discount. Also, if y'all are interested in possibly doing EMS, I welcome you all to come do a ride-along. Ride-along is a program we have where the community can come and get on our ambulance for a shift and come and see what it's like to be on the truck. Get out there and help the public. Right off the top of my head, I know this is really terrible because I'm a supervisor, I don't know if you have to be 18 or if you can be 17 with a parent permission. If you all are interested, you can check out our website or you can call and they'll be happy to answer that for you. And then there's 3 links down at the bottom that I've put in there. The first one is the Texas EMS site. This is anything that you would want to know about EMS in Texas. It lists all the services, if there's some job openings, how we collect data, how we do patient care. It's all listed there. The National Registry of Emergency Medical Technicians. This is kind of like the national EMS certification. It's required by Texas on your initial testing. So when you do your EMT basic in Texas, you're automatically testing for your national registry. You don't have to keep it, but you at least have to test for it your first time. Basically, it's a higher standard of education for EMS. And then the National Association of Emergency Medical Technicians. This is kind of a lobbying group or a professional organization. They help us with getting bills passed to support EMS functions. If you join, there's a whole bunch of benefits that you can get out of it. They even have, I believe it's a $10,000 life insurance policy. You get discounts to stores and things related to EMS. So I highly encourage you all to check that out. All right. Any questions? Come on. Yes.
If you want to be in EMS but still want to go to a 4-year college rather than going alongside, what would you recommend setting, like majoring?
If you still want to do EMS,
Yeah.
I would recommend some type of health program. Many colleges, and this is actually how I started out in college, many colleges have a pre-med or a pre-medical type program, and basically that's going to get you all your general education requirements, your English, your math, your health sciences, so your biology, your chemistry, statistics, things like that. That will prepare you for going into EMS. And actually, when I started college, like I said, I went that route. And then during my tenure in college, I found that my college had an EMS program that was actually a 4-year program. So there are 4-year and 2-year EMS programs out there. So you can get an EMS degree, you still have your college degree, and you get to go into EMS. Good. Yes?
How long does it take to become a
The minimum amount of time is, let's see, it's 6 to 8 months for EMT basic, because you have to get that first, and then your paramedic course is usually a 1.5 to 2 years after that. So we're going on about 2.5 years just to go through the education. Now I highly recommend, now when I say I recommend because I didn't do this, I highly recommend you get some experience as an EMT first before you go into EMT intermediate or paramedic, because you get to learn how things work in the EMS world. You get to practice your assessments, you practice your vital signs and your treatments. Get comfortable with that first and then move on to your higher levels of care. It'll make so much more sense once you get comfortable in one section and then move on to the higher. Like I said, I didn't do that.
And plus, you can always be working as
Exactly.
as an EMT while you're going to school to get your
Yeah.
paramedics. You're making money and you're doing something to help yourself.
The jobs for EMS right now are, you all live in a very beneficial area because we have the Texas Medical Center. I kid you not, in Harris County, we have over 400 licensed ambulance services. In the state of Louisiana, there are 37. Many of these services are transfer services, okay? So they go hospital to hospital or rehab facility to a hospital or to a doctor's office. They do many of them do 911. Yes?
How many calls do you get a day?
Whew, that's a good one. All right, so,
Well, I'm working none.
yeah. So our company has a service area of about 250 square miles. That's from Humble all the way over to, what what is it? It's Huffmeister, to Huffmeister, down to the Beltway, and then up to the county line. We have a very big service area. In that service area, we have 16 trucks. So it depends on what truck you're on and what service you work for. There's one of our trucks that's down, let's see, our busiest truck is over near 1960 and Ella, and they average about 18 calls in a 24-hour shift.
I work over there.
Yeah?
I work at whatever over there.
Okay, so you probably see them all the time.
They always
Yeah.
come by and get lunch and
Yeah.
everything here.
Yeah. And then I work, when I'm on the truck, my truck runs out of North Eldridge and North Point, and we average about 3 or 4 calls in a 24-hour period.
From by the Silverado movie theater.
Yeah.
Up there.
So it greatly depends on where you're at, who you work for. I've seen actually some services, especially in rural like Alaska or rural county America, that paramedics will usually work 72 to 96 hours straight and maybe have 3 or 4 calls in that entire time. So it greatly varies.
Yeah, you could have no calls in an entire shift, or you could have, like you said, as many as
Yeah.
18 or 20. The great part is you get paid the full amount no matter what you do.
Yeah.
Some days you
So-
earn your money, and other days you do not.
Yeah. Yeah, those days when we can sit back and relax, those are good days because no one actually wants to do their work, right? Yeah.
It's true.
So come on, throw them at me.
What happens if you're getting food and you get a call?
Depends on if we have our food with us or not. My rule of thumb when I have trainees and when I have students riding with me, I say get your food to go, because as soon as we get a call, whether we have the food or whether we don't have the food, we have to leave. We respond emergency to all calls, so we have to be on our way to the call in 1 minute from the time we were dispatched. So if we don't have our food, I usually tell the people who are making it, we will come back and pick it up when we can. So we had a crew or a volunteer, I should say an observer riding with us a couple of years ago, and he was doing a documentary for a TV show, and he was talking to us about taking breaks, and we kind of chuckled. We're like, we don't get breaks. It's like, well, I have to have a break. It's union regulations. I'm like, okay, well, we'll see if we can get you a break. But as soon as we sat down to eat, we got to finish eating, and then we got sent to a call, so that worked out. Yes.
How do you deal whenever there's a huge congestion? How can you get from one spot to another?
Oh, like traffic? That's when our lights and sirens really come into play. Now that takes some training. So learning to drive a car regular is pretty easy. Learning to drive a car that's 3 times bigger than your sedan, and drive it faster and in more traffic, that takes some practice. So we have a lot of options when it comes to congestion on the roadways. If need be, we can do what's called contraflow. So basically we go into the oncoming lane to get around our traffic. It is state law that vehicles yield right away to us. So when they see us coming, they're supposed to pull over to the right and stop and allow us to pass. Now there are some occasions where it is just completely gridlocked and there's nowhere for them to go. In that case, we will turn off our siren, but we'll keep our lights on, and we'll wait for the light to turn, because we're not going to force crews or cars out into an intersection when they have a red light that's dangerous for them, that's dangerous for the oncoming traffic. So we'll wait until the light turns. Now we also, many of the lights in our area are equipped with a signal override, signal preemption device. So basically we can tell the light to turn green in our favor.
That's what I thought. You left it on your car? Yeah.
I asked it the other day.
Yeah, that really does come in handy a lot of times.
Yeah.
It's automatic. The light itself has to be equipped with the device, and so when it recognizes the signal being transmitted from our truck, it turns all the other lights red and then turns ours green because it knows which direction we're coming from. Yeah.
So it's
What if
not
they just turn
every
both
single light?
Yeah.
Oh, yeah. There's some lights that have.
Yeah. Good questions.
Yeah. What's the grossest thing you've ever seen?
Oh, don't ask me
Gotta ask you
that.
that. Gotta ask you. It's bad it's not right
You
before
see a lot of grotesque stuff sometimes in EMS because you see people at their worst. I've been doing this now for 7 years, and I've tried to stop keeping track of that. So, I mean, we've seen people with severe trauma injuries. We've seen dead people. We've seen injured and sick children. And if you let it take a toll on you, it's going to wear you down, and you won't be able to continue doing your job because you're so overwhelmed with what you see and how to take it. So, like I said, I've tried to stop keeping track of that. But in actuality, we have a program, and many emergency services do. It's called stress debriefing. So if you see a really bad incident, you see a kid get hurt or something that just really hits close to home on you, we have a service that you can actually go to. You can talk to them about it, and it's kind of like a counseling service. They help you work through it so that you express it. You rethink on it. You think, how can I have adjusted to this, or how can I make it? How could I have made it better, or couldn't I have made it better? And then it allows you to move on with your life. Because if you just get stuck thinking about that, it's gonna, like I said, it's gonna wear you down. Let's see here. Doing the air medical stuff is pretty interesting. When we call for life flight, that's usually pretty cool when we get the helicopter to land right in the middle of the freeway or right in the middle of the road. But usually that means our patients are really injured. When it comes to treatments, the higher the level of care, the higher your level, the more things that you can do. So, like I was talking about intubating patients the other day, putting the tube down their throat to help them breathe. So in order to facilitate this, we do what's called rapid sequence induction. So basically, we give you a medication to put you to sleep, and then we give you a medication that chemically paralyzes you. Then we put the tube down your throat. But it's really so cool to see some of these medications, how they work, how they benefit the patient. So, like this one right here, this is called Zofran. Anyone heard of it? Yeah? So, I mean, small little pill and it dissolves on your tongue, but this can make the difference between someone vomiting all over your ambulance, or it's really powerful anti-nausea medication. Or, let's see here. Strangely enough, we carry aspirin. Does anyone know why? Why do we carry it? You know?
For heart attacks?
Not for headaches. We carry it for heart attacks. Very good. Very good. It stops platelets from coagulating, so it stops clots from forming in the blood. So if someone already has a clot in their heart that's causing the heart attack, it keeps that clot from getting bigger. So simplest medication sometimes can so good job. We got 5 minutes. Yes.
On average, how many days do you work a week?
That's a good one. All right, so
I'm jealous of this right here.
so my schedule is unique because I'm a supervisor. Our regular field paramedics work 24 hours on and then have 72 hours off. So work 1 full day and have 3 full days off. I work 24 hours on the ambulance. I got 24 hours off. I work 2 12-hour days, starting at 10, so I can sleep in. And then I have 4 days off. So on average, our regular paramedics work 8 days a month.
Isn't that great?
Yeah.
A 9 to 5 person wears what? 5 times 4? That's 20 days a week.
Yeah.
So 20 days a month, whatever. 20 days a month versus 8.
So, yes. Not when I'm off. I only get paid for days that for hours that I'm actually working. But my average working hours per week is about 42 to 48 hours. So it's a full-time position, and actually I work more than the traditional full-time person. But it's because of how the shift lengths work out. But I still have more time off.
Yeah, because he's sleeping during some of those hours. You know, like normally when you're working an office job, you leave work at 5 or 4, whatever.
Maybe y'all can say you get paid to sleep.
Yeah.
But in addition to our pay, I'm not going to discuss pay. Sorry. I can tell you that it's comfortable. You can make a living off of it. We have excellent benefits. So for my company, I don't have to pay health insurance, vision, dental. They pay for my disability insurance. If I have to miss work because I'm sick or injured, I get paid for that. If I have to go to court to testify on a patient, I get paid for that. So I have very well benefits as well. Good. Oh, we have 5 minutes. Come on. Yes.
What does the ride-along look like? What are you doing?
You're observing. So yeah, you won't be able, you'll be able to be at the patient's side. You won't be able to touch the patient or do any type of patient care. So when you sign up for the ride-along, you're required to have a uniform per se. For us, it's a white button-down shirt, black pants, black shoes. And we'll give you an ID badge that says observer on it. You'll be in the back of the ambulance. You probably won't be in the front, but you'll be able to see how the crew works when they're not at a call. When they do get to a call, how they take care of the patients, how they take care of multiple patients, what it looks like when we're transporting a patient, how we maintain caring for them during the transport, and then when we get to the hospital, transferring the patient to the hospital care. Yes.
If a student were to do a ride along, like how long would they be doing that for? Like
How long the shift is? They're usually 11 to 12 hours. You can do it during the daytime. Daytime is from 7 a.m. to 6 or 7 p.m. at night, and then the night shift is from 7 p.m. to 7 a.m.